The sick care industry is at it again. This is what a headline read. A surprise billing law loophole. Her pregnancy led to a 6-figure hospital bill. You heard me right, and if you are reading it along with me, you read it right. This is the story of Danielle Laskey and the birth of her son. It was the first day of her family's vacation in San Juan Island last June when Danielle, who was 26 weeks pregnant, thought she was leaking amniotic fluid. A registered nurse, Laskey, called her OB-GYN back home in Seattle, who said to seek immediate care. I mean, that's important. If your water has broken, you got to get into that hospital right away. You can't play around with it. Now, back in Seattle, doctors at the clinic found Laskey's water had broken early, posing a serious risk to her and the fetus, and ordered her immediate admission to the Swedish medical center. She delivered her son after 7 weeks in the hospital. Though she was treated for multiple postpartum complications, she was well enough to be discharged the next day. Her son, who is healthy, went home a month earlier. Now, the complicated birth naturally required some follow-up procedures. I mean, that's just common, right? It's to be expected. But Laskey soon developed a fever and body aches, and she was told by her OB-GYN to go to Swedish emergency department. She said doctors there wanted to admit her when she arrived on August the 20th and scheduled a procedure for August 26th to remove a fragment of placenta that her body had not eliminated on her own. Again, people, very serious situation for a pregnant mother and a mother who just gave birth. Very serious situation. Now, Laskey would complete the procedure, ready to move on with her family until the bill came. And here it is. You just cannot make this stuff up. Do you see it? And for those of you who are just listening and not watching, let me tell you, your total is $121,887. And they had the nerve to put 87 cents down there, JB, too. They had the nerve to put the 87 cents down on that bill. Now, this is disgusting. It is an example of a sick care industry rearing its ugly head, and the pro-life politicians think that this is acceptable. Where they at? Where you at, pro-lifers? We need universal health care in the United States of America. They refuse to do it. And how did the bill get this high? A contract between Regenerates, Blue Shield, Laskey state-sponsored plan, and Providence Swedish. That's how it is. Let's put up this. It turns out the Swedish Medical Center was out of network. Ain't this a blip? Just out of network. This is how her bill got so high. Makes no sense. If we had universal health care, we wouldn't have to worry about this kind of stuff. And furthermore, the broader contract allowed Swedish to bill members whose plan received out-of-network services their 50% co-insurance, the patient's portions of the overall cost. The insurer allows the provider to charge with no out-of-pocket maximum for the patient. We have a problem. We just got a problem. And a recent study by Mount Sinai in 2022 found that public health insurance would be less of a burden on birthing families, especially low income. That public health insurance, including Medicaid, was associated with starkly lower risk of burdensome health costs than private insurance, particularly when health insurance premiums were included in spending for birthing parents with low incomes. Implementation of the Affordable Care Act did not significantly change the risk of catastrophic spending for parents. Jessica, we can't make this stuff up. This is real in the field in America in 2023.
I can't even begin to comprehend how there are still people who don't think we should have universal health care. We already tried to have market-driven health care, and the market has failed time and again. We already tried that. I can understand when people say, I want us to have a free market because, I like certain kinds of products, and we probably wouldn't get that if the government was making products. I don't want, my hairspray to come from the government. That is so different from something that you need to continue to live. We need universal health care because people's lives shouldn't be a commodity or something to make money off of. It's just fundamental. Not only that, it's not necessary. We've advanced so much as human beings and built so much that we can take care of each other. Isn't that the whole purpose of people waking up and going to work and participating in our economic system? so we can improve our lives and meet our material needs.
That's right.
The economy as it's working right now is doing the exact opposite of that. And the consequences, so rich people can only have babies now? That doesn't seem like a great solution for anybody.
Not at all.
The Republicans now who are talking about, how they're so worried that population's declining.
Yeah, it really makes no sense. A 6-figure bill from having a baby. This is not right. It's immoral as hell.